Okay, so welcome to week one, lecture one. Thanks for everyone for joining. We have nearly 40 people, which is wonderful. Look, for some of you, I just want to say at the outset that for some of you, this may be some revision, and that's great in terms of this lecture. You know, some of you might be thinking, yeah, I know what chronic illness is, I know what population health is, and you know, particularly for the people who are doing, who are also studying public health as well. Welcome. I'm aware that some of this may be revision for you, or you may not have covered it yet, but you will be. So it's always nice to refresh. So try and take that as an opportunity to kind of deepen or broaden your knowledge in this area if you're already familiar with these concepts. And again, for some of you, and you know, who have done already first and second year units, you might be thinking, oh yeah, we've spoken about cancer, we've covered cardiovascular disease, but the reason, so it's not like we don't know what other units are covering, it's just that we all tend to focus on the national health priority areas. So we're all deliberately focusing on the key health priorities that have been identified. So we do cover a lot of the same kind of conditions, diseases, but there's a reason why, and we generally tend to cover them from different angles and approach them from a different perspective. So, you know, just give us a go with that in case you kind of start to think, oh, you know, I already know this. There will be something new, I promise, or an opportunity at least to reflect and deepen or broaden your knowledge. So let's see if these slides will roll for us. Yep. So overview. Today, firstly, chronic illness. Obviously what it is, but also more particularly in the context of Australia. What does it look like in our country? Which are the particular ones that have a really high prevalence and different risk factors and things like that. Very briefly, we're going to touch on population health because it's really important actually, you know, before we think about health promotion, or at least at the same time, we need to think also about different, well, the population as a whole in terms of here in Australia, but then also subpopulations. So here in Queensland, but then different subpopulations within that, males. So men's health, females, you know, women's health. What are the particular things that we need to know? Child and infant, adolescent health as a particular population. Aboriginal and Torres Strait Islander health, the health of people from different cultural and linguistically diverse backgrounds. You could look even further at, you know, like students here at QUT in terms of a population. If we were, you know, trying to address a particular issue, we would want to look at what population are we targeting, because the way we approach that will most likely be very different depending on which population it is. You know, one of the most common ones I'm sure you'll be aware of is we have an aging population. So, you know, older people's health, whether it's residential aged care or even, I guarantee, whatever ward you're in an acute setting, you know, you will, you know, ED. Residents from aged care facilities are frequently transferred to ED. What for? Often falls, hips, fractured neck of femur. And look, these people, I feel bad saying these people, our elders, the elders in our community, will have, you know, not just one, but often 2 or 3 or 4 different chronic conditions. So we'll touch on that as we go through. Still on the overview slide, sorry. So chronic illness, population health, and then we'll take a deep dive into health promotion. And then at the end, we'll have plenty of time, I'm sure, for some Q&A. So let's keep rolling. So just a reminder, your textbook, Living with Chronic Illness and Disability. It does include, as I've just said, disability. And while we're not going to focus in a major way on that, it is important that we're aware that with chronic illness often comes disability. And that's important because just being able to function in your ADLs and even in your broader life, so in terms of work, being able to work and maintain your occupation, which impacts on your income, being able to play those other social roles that we have. So as a father, as a husband, as a wife, as a mother, you know, chronic illness can really have a big impact in terms of when you're no longer able to function as you used to function. And then that can really cause lots of problems, you know, not only just in terms of income, but think about mental health. If your identity as, let's say as a professional or whether it was a more social role kind of thing, but if you're no longer able to be who you knew yourself to be, who you identify as, you know, just stop and think for a moment about the potential impact in terms of your self-esteem, just the meaning and purpose that you once found in life if you're no longer able to do that. So we will touch a little bit on disability because it's relevant, but it, you know, like I said, it's not a major feature in terms of, you know, our assessment. We're not going to ask you to write an essay on disability, but it's certainly relevant. So, you know, always just stop and think, how might disability be relevant here? So, chronic disease, it's literally pitched as Australia's biggest health challenge, and it's growing. It's not just rhetoric, we're not just saying it. So look, chronic illness is the leading cause, chronic diseases are the leading cause of illness and disability and death in our country. So 90% of all deaths, this is, when you look at this kind of population level data, often we're a little bit behind because of the time it takes to collect it all and analyse it all. But so just 7 years ago, chronic diseases accounted for 90% of all deaths in 2011 at least. So there are lots of reasons for the increase in chronic disease. Chiefly, if you just think about it, you know, since the advent of penicillin and antibiotics, we're actually living longer. In times, in, you know, decades past, people would die a lot quicker because we didn't have penicillin, we didn't have antibiotics, we didn't have the treatment and the technology that we now have. So a lot more infant deaths would occur during labour. So, you know, and this is again looking at population health in terms of health of populations. Our life expectancy is longer, we're living longer, but we're living longer with more illness. So that's why it's important for us to know. So, you know, there are positives, there's benefits. We like having a longer lifespan, but part of the trade-off of that is that we're living longer with more, you know, comorbidities. So also changing lifestyles. I mean, look at technology these days. I mean, the amount of screen time that kids have, and let's say just for one example, if children are now spending more time either gaming, whether that's at a desk or on a mobile device, a tablet, if people are more sedentary, if our children are more sedentary, then you know, you've got to ask whether that relates to the higher incidence of obesity, and obesity is certainly a major risk factor for chronic illness. So lifestyle is a really important factor in terms of health and illness. So we're going to cover that in more depth as we go throughout the semester. But it's just important to think, you know, chronic disease doesn't just happen. It's not something that you just catch. A lot of it is actually brought about through changes that have occurred in our lifestyle, and also changes in terms of health practice. So we're living longer. which means that we have more time and more exposure to actually develop chronic illness. So what is a chronic disease? So by definition, so we're looking at a long-lasting condition which is persistent in terms of its effect, and it includes often disability. So not just an acute episode, it's actually a long-lasting condition and the effects persist. So there are social and economic consequences. When you're talking about living for years, if not your whole lifetime with a particular condition, that has major impacts on your life, whether that's personally and or professionally. So your ability to work, your ability to function as in your social roles. So yeah, look, there's a lot. It may seem like there's repetition in this, but it's important. We do reinforce the message that chronic disease is increasingly common, and it's a growing priority every year. Every year, governments and health organisations keep saying again and again, we need to get on top of this, because the health system literally can't cope. It won't. So hence, a lot of focus on trying to find other ways to work and to work smarter rather than harder. So the Australian Institute of Health and Welfare, or the AIHW, this is a really useful source of information and data. So for those of you who may have already checked out Twitter, I tweeted one resource or one report from them this morning, but I will touch on that in this lecture anyway. So the major groups of chronic disease that are commonly reported include the following. So arthritis, asthma, cancer, cardiovascular disease, COPD, chronic obstructive pulmonary disease, diabetes, and a variety of mental health conditions. Now, obesity, you will see obesity. There's a chapter on obesity in your textbook. Now, this is an interesting point. Without getting bogged down in debate, there is actually overseas obesity is recognised as a chronic illness. In Australia, the national health organisations acknowledge the relationship and the relevance of obesity to chronic illness, but at present it's not technically recognised as a chronic disease, but it's very relevant, and I think that's probably just a matter of technicality. It's something that we really need to be across in terms of the implications of obesity, whether or not it's actually classified as a chronic disease. It's certainly a major risk factor for a whole suite of chronic conditions. Now, so just a little bit more about the characteristics of chronic illness. Like I said, this is in contrast to acute illness, which is more about, more likely viewed as an episode, which has a, generally a short onset and short duration. So most chronic illnesses don't just resolve, and often they're generally not cured actually. So it's usually a matter of learning to live with and learning to manage a particular condition. Yeah, think of diabetes, for example. Now, so some chronic conditions can be immediately life-threatening, such as heart disease and stroke, while others linger over time but still need intensive management. So again, diabetes. So most chronic conditions persist throughout someone's life, but they're not necessarily always the cause of death. So, for example, arthritis. So other general characteristics, often chronic illness has complex causes. There are usually multiple risk factors. Importantly, I want you to, really just dig down and understand risk factors, especially for both of your assessments. These can either be modifiable and behavioural risk factors or non-modifiable. So modifiable risk factors generally tend to be about behaviour or diet, so food intake or you know, either dietary or behavioural. So we can modify those generally. If we are more physically active rather than sedentary, if you know, we eat particular or less particular foods or drinks that are associated with chronic illness, then we can modify that. Whereas non-modifiable risk factors are more biomedical. So think about genetics, for example. If you have a predisposition to a particular condition, you generally can't control whether you have that or not, if it's in your genetics. Or, for example, just by being male, I myself can't control the fact that I'm at higher risk, or you know, I'm more likely to, let's say, testicular cancer, whereas breast cancer, males do actually have breast cancer, but you know, females might be at more risk, and that's not because of behaviour; it's purely because of a biomedical risk factor. So back to more general characteristics of chronic illness. So usually long periods between the onset of the illness and actually feeling its effect. And there's generally some functional impairment or disability. And I've already touched on that in terms of being able to work, being able to function as you normally would. Now, just a little bit more on disability. So as we've said, chronic illness can lead to long-term disability, which essentially is the loss of your ability to function in life, in work, and that's whether it's biomedical, psychosocial or spiritual domains of health which might be impacted. So looking at defining disability, it's understood as a multi-dimensional concept relating to impairment in body structure or function, as well as limitation in activities or restriction of participation in one's environment. It's a pretty holistic global definition of disability. So just understanding disability can occur without chronic disease. So for example, developmental or intellectual disabilities. But you know, we're looking here more explicitly at disability arising through chronic illness. So we're touching a little bit on rehabilitation. So the term rehabilitation refers to the personal journey undertaken by someone experiencing disability. So think of stroke, for example. I wonder how many of you might have had a chance to work in a stroke rehab unit so far. If you have, then, you know, really dive into the chapter in your textbook on stroke, and really think about different, you know, secondary and tertiary levels of prevention that we're going to cover. So look, there are a whole variety of interventions that we can use in rehab for chronic illness. So just looking here at stroke or cerebrovascular accident, CVA. So what's our goal? When we look at a stroke rehab program, we want to help an individual to relearn the skills that they lost when the stroke affected part of their brain. So really, it's ultimately about helping someone regain the independence and improve their quality of life. So rehab is person-centered, it's mutually agreed, and it's about achieving goals ultimately that are person-centered. So this is where that partnership comes in. It's not just that we're deciding what the goals are, but we work with someone to identify and work towards achieving the goals that are meaningful to them. Now, so you know, I touched on the importance of this unit last week in the orientation lecture, and I genuinely mean it when I say, you know, I think I said it last week, I remember the equivalent unit that I did when I was training, and you know, just more and more I see the importance of it. And these things were once missing in terms of nurse education. We weren't really educated about chronic illness and disability. And I mean, really for lots of reasons, but because it's just a bigger and bigger priority each year, it really has by necessity been introduced in terms of we really need to be able to work confidently with chronic illness and promote health and well-being. So we're beginning to think about prevention here. I mentioned already some different levels of prevention. So you're going to see these terms, morbidity, mortality, they're kind of epidemiological terms when you look at population health data. And really, so if you look at the AIHW reports, you will see disability adjusted life years, or they're called, you know, DALYs, D-A-L-Y, and lots of other terminology, but we don't need to get bogged down in that. Really, you know, morbidity is looking at the prevalent, not prevalence, sorry, it's looking at the extent of illness, and mortality is looking at death rates, really. So just getting back to prevention, you know, the major chronic conditions are generally amenable to preventive measures. So in other words, we can generally prevent most of the chronic conditions that afflict the population. So it's kind of, you know, we have this huge problem of just such a large proportion of people with chronic illness that actually could have been prevented. And that's why a huge emphasis in this unit is looking at helping people prevent. There are different levels of prevention, and you know, there's a first year unit, NSB303, which is largely focused on primary prevention. So meaning, let's prevent anyone from actually first getting cancer or asthma or diabetes. If we can, you know, prevent someone from actually getting it, then that's best. You know, an ounce of prevention is better than a pound of cure, kind of thing. But there are secondary and tertiary levels of prevention as well, which pretty much means that once someone's got cancer, we can still do something to prevent that from progressing. We can still promote health and well-being, so it doesn't get worse, any worse than it can be. So, so that's why we're looking at behaviour and things like that in this unit as well. So coronary heart disease, heart failure, stroke, diabetes, renal disease, a whole range of respiratory conditions, mental illness, cancer, arthritis, osteoporosis, persistent pain. So these are things that are generally responsive to preventative measures. So the National Chronic Disease Strategy, this is featured in your textbook. So this has been in place actually for quite a while now, for several years, and it's in the process of being modernised and redeveloped. But historically, it's targeted 4 key strategic areas. So prevention across the continuum, early detection and early treatment, integration and continuity of prevention and care, and then self-management. Now, these are all really relevant to what we're going to be learning about. So I can see in these 4 points, I can see all of the, you know, primary, secondary, tertiary levels of prevention, and self-management is, you know, going to be a huge focus of the unit and your assessment. So the national priority health areas, which I referred to before. So you can see that the top priority health areas as identified in this strategy were asthma, cancer, cardiovascular disease, diabetes, and a variety of musculoskeletal conditions. And as I mentioned before, there's a new national strategic framework for chronic conditions, which is going to supersede this national chronic disease strategy. So let's look a bit more locally. Let's look at our own state here in Queensland. So, you know, this is a couple of years old now, but it's projected out to 2026. So this is a nice strategic look at the health of our state, or the people in our state at least. So looking at the population, so in the next 7 years or so, it's projected that we'll have 6 million people in the state of Queensland. You can see that we're getting older. You can see that 55% in very remote areas. So this is coming back to social determinants of health, which we will touch on a lot more in the next week or two, and a little bit later in this lecture. So moving from the population, let's look at disease. So chronic diseases are the primary cause of death in Queensland and internationally, and that impact is increasing. And again, the majority of chronic disease deaths are due to both cancer and cardiovascular disease. Thinking again about obesity, so it's projected here 3 million Queenslanders will be overweight or obese by next year. And 2/3 of the burden of type 2 diabetes is due to excess weight and sedentary lifestyle or physical inactivity, whichever way you want to kind of say it. So again, there's that link between obesity and also sedentary kind of lifestyle, and in this particular instance, diabetes. So look, interestingly, so we've got a high mortality rate, so the deaths associated with cardiovascular disease, but we've also got an increasing survival rate of acute coronary heart disease. But coronary heart disease and stroke are actually 8 to 9% higher in our state of Queensland than across the rest of the country. So, you know, just interesting to compare, you know, where we sit compared to other states, and different patterns of change. So looking at cancer, this is another important point, and it relates as well to, you know, years ago we would die a lot younger because of, you know, but then because of a lot of changes and advances in health care, we're actually living longer, which is good, but there are problems that come along with that. And similarly, cancer, you know, traditionally people would die much sooner of cancer, but we actually have a growing emphasis on cancer survivorship. So survival of common cancers has actually improved here in Queensland. And, you know, assessment 2, we're going to really look at what do we do, how can we help promote health for a cancer survivor in terms of minimising the chance of recurrence. But here in Queensland, so lung cancer, the prognosis for lung cancer still remains poor here in Queensland. So less than 20% survival rate at 5 years from the point of diagnosis. We've already touched on life expectancy, but so here in Queensland, that was national that we looked at before. And look, again, so this is an important point to look at Indigenous health. So, you know, the Close the Gap campaign is something that has been promoted for a long time now, but really we haven't seen the results that we'd like to have seen. So it's an ongoing priority in terms of looking at, and this is why we need to use that population health lens in terms of looking at, well, what do we know, and how does that inform us in terms of what we need to change and how we can, you know, perhaps better approach, because the disparity in life expectancy is just not It's not acceptable, really. And look, it's not a, I'm not going to sit here and say that it's a simple, that there's a simple solution. It's a um, very complex problem, and there's no simple fix. But I think the fact that it's complex doesn't mean that we shouldn't be working harder towards addressing that. So there's a gap of 10.8 years for males and 9.6 years for females when you compare Indigenous and non-Indigenous Queenslanders. There's some workforce data here as well, and budget. The main interesting thing I would point out about this is that nearly 15 billion, certainly over 14 billion dollars, that Queensland Health has the largest budget of any Queensland government department. So we're spending more and more. So along with prevalence rates of chronic illness rising with the aging population, where we're chasing our tails, spending more and more every year. But like I said, we're going to look later in maybe the third or fourth lecture in terms of different models of care and looking at how we're trying to achieve better outcomes. Not necessarily having to, spend more and more, but maybe it's about spending differently and working differently. So a little bit more, I've gone through these just in smaller print. Apologies for that. It's just a bit more of a closer look at CVD and cancer and obesity and diabetes there. So, I think I actually didn't mention this, but we have here in Queensland the highest rate of adult obesity in Australia, and our incidence of diabetes is projected to double. This was out to 2026. So like I said, it's not just me saying it, it's not just your lecturer saying it. The data shows that the problems around these chronic conditions are getting bigger and bigger. So let's look at an example of a local health service. So Sunshine Coast Hospital and Health Service. So the incidence of chronic illness and disease, again, steadily increasing, and this is reflected in healthcare demand. So approximately half of all admissions to these facilities in Sunshine Coast were for chronic disease in 2016. And projecting again, so if there are no changes, if we don't do anything differently, it's estimated that there'll be 116% rise in patient admissions in the next 7 or so years. And just going back to the point made earlier, that a large proportion of these admissions are actually avoidable. So when you think about the bottlenecks in ED and when hospitals are in lockdown, a lot of these admissions could actually be prevented. So that's one reason why we're looking at what can we do in the community in terms of maybe subacute care, but for all of this, we need to think about how we can educate and support people to self-manage and live better with chronic conditions without having to present to ED all the time. And we're going to look at different technologies that can help with this. So that is, about half an hour on chronic illness. It is an overview, but please read through your chapter. I think it's one of the first chapters. It's called Frameworks for Chronic Illness for Nursing Practice. It's one of the first chapters in your textbook, so please read up further on that. But that's a very broad overview.